you ever wonder about a childhood cancer that would cause blindness and also the kid would have their eyes taken out? This condition is extremely severe, very devastating. I'm Dr. Harvey TRAN, and I'm going to talk to you about a childhood cancer called retinoblastoma. It is caused by a mutation in the RB1 gene. This condition is so devastating and it's very significant that it also affects a celebrity that you know. Eric Trump, who's the son of the former US President Donald Trump, also had this condition in childhood. Lucky for him, it was detected early and treated successfully, so the cancer is gone into remission. Another famous person that suffered from retinoblastoma is Chadwick Boseman. As you can recall him from the character Black Panther, he also suffered from that form of childhood cancer, retinoblastoma. It was detected early and successfully treated, but then later on in his adult life, Chadwick Boseman died because he suffered from colon cancer, and that was the cause of his death. Now, interestingly, another famous person that many of you know about is Taylor Swift. Taylor Swift recently visited a 5-year-old girl. Her name is Chloe, and the patient suffered from retinoblastoma as well. And the visit was very surprising and delivered that great joy, that big smile on Chloe's face.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging Biotech Hedge Fund Evergrow Biohealthcare Capital. We invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. By investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
Within 6 months, we have an over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
Welcome to our 43rd Open Mic webinar. The topic for this week that we are going to discuss is on retinoblastoma. This week, our chairman of the Medical and Scientific Advisory Committee, Dr. Van Nguyen, did a presentation on retinoblastoma where he discussed the latest trend and ongoing development in this field. Here, I'm going to give you a brief overview or summary of what Dr. Van discussed. First, Dr. Van went into the definition and cause of retinoblastoma. It is a form of childhood cancer of the eyes. It's affected the retina or the back part of the eyes, and it is due to the mutation of the RB1 gene.
Thank you. So today we could be talking about advance in diagnosis and treatment of retinoblastoma. I want to thank Dr. Miley for putting the slide set together. As you see, retinoblastoma is not a common term that we normally speak about, as this condition is rare. But as you can see here, a picture of a child, that is a sign of retinoblastoma, unfortunately. Definition we have, it's a rare type of eye cancer, incidence in about 3 to 40 cases per million live births per year. It primarily affects young children, usually under 5. Average age is at 2 years. The distribution is equally in boys and girls in all races and ethnicities. As you see on the cartoon here, you have healthy eye, and you have the eye that's been affected by retinoblastoma with cancer cells at the retina there.
Dr. Van then discussed the sign and symptom of this disease, like loss of vision in the eyes. On physical exam, the retina will look white. There will be a white spot on the retina as well, and Dr. Van will share that in greater detail with you.
The symptoms, we have leukocoria, which is white pupil reflection. It can also cause eye movement disorders such as strabismus and eye redness, eye swelling, vision problems. As you can see there, the white pupil, the child may have to squint to see, or frequently the child might have inflamed or swollen eye, and then the child also have enlarged pupil.
Next, Dr. Van discussed the various different exams to diagnose this condition, and then he went into the most popular or the current treatment modality, and that is with enucleation or removal of the eyes. A second common treatment is with chemotherapy, and then Dr. Van discussed the most common chemotherapy that are being used, like carboplatin, also vincristine, that's being made by Pfizer and Eli Lilly.
Diagnosis, we use ophthalmoscopy or fundoscopy to look at inside the eye to see the retina. We also can do the ultrasound of the eye, get MRI and CAT scan to make sure there's no other area of metastasis. And of course, once you make a diagnosis, you should consider genetic testing in the child and also in the family for the mutated gene. And you see here on the fundoscopy, we have abnormal cancer cell growing in the retina there. You see those white spots. Treatment and outcome, and you can see here we do various treatment, including removing the eye and nucleation. We also have available cryotherapy, laser therapy, radiation therapy, and of course chemotherapy with targeted drug therapy. Commonly prescribed medications, as you can see here, vincristine, makers are Pfizer and Eli Lilly, carboplatin, makers are Pfizer, Bristol Myers Squibb, Hospira, and Teva.
Next, Dr. Wei discussed about the novel TRAN, and we had our discussion on the novel treatment modality, and that includes gene therapy with CRISPR-Cas9. We discussed about the potential of having an artificial eyes as well as artificial retina, and the interface of using AI and technology to integrate the artificial eyes into the brain and to restore the patient functionality of vision.
New medical trends we have, such as intra-arterial chemotherapy, intravitreal chemotherapy, genetic therapy using CRISPR technology, which we touched on in the past, immunotherapy, like we mentioned in the past as well, with CAR T cells. And we can personalize the medicine approach. The new medications now being investigated for usage in retinoblastoma, including selinexor or XPVO, and then you have belinolostat. The maker is Acotec Biopharma, and of course, the new whole host of monoclonal antibody therapy and immunotherapy will be coming as well.
If you want to capture this lucrative opportunity while investing in innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise, reach out to us, contact us. We'll schedule a call to see if we are the right fit for each other.